I've been asked, what do I think of Ashley Black's Fasciablaster? For those of you that don't know, it's essentially a roller with almost like spike-like projections that the woman will roll onto her thighs where she has this cellulite. And the idea behind it is she does this very vigorously a whole bunch of times over several days. It'll improve, and there's several pictures on the Facebook site showing a nice improvement. So what do I think of it? First of all, let me preface my comments. Men don't get cellulite, only women, so I haven't tried it on myself. However, I'm skeptical. So why am I skeptical? One of the treatments I do, and this is the laser, it's called the cellulase treatment for cellulite. What I'm doing is numbing up, let's say, the thigh, either the front or the side or the back of the thigh. And after I've numbed it up, I'm going in with a laser beam underneath the skin, and I'm breaking those fascial bands that are pulling the skin in to cause the indentation. Then I'm taking the laser and I'm shining it to the underside of the skin to heat up the skin. The idea behind that is when you heat the skin, you stimulate collagen elastic fibers to form. And the person will continue to improve for 6 months after I do the cellulite treatment. It's only a single treatment. Having said that, basically, I can't eliminate the cellulite. I can often improve it, sometimes a small amount, sometimes dramatically. Does it work on everybody? I would say about 80% of the patients improve with cellulite treatment. So that means 20% of the people don't improve. Nobody's been made worse. However, it's an aggressive treatment. I have to numb it up, and I'm in there with a laser beam. I find it extremely hard to believe that somebody using essentially a glorified rolling pin, rolling the skin, can generate enough force to actually break those fascial bands down, because they stretch and they're also tight. Secondly, even if they break those bands down, I find it hard to believe they just won't reform, because that's what scar tissue does, even though fascial bands are a little different than scar tissue. If they reform with scar tissue, it'll still have an indent. People would say, well, what about those great pictures on the Facebook site? Anytime you cause edema or swelling, and the women are rolling their legs very aggressively, sometimes they'll even get bruising, you're going to get swelling. If you get swelling, it's going to camouflage the cellulite. So it's not clear on those pictures how long they're taken. So the question I would ask the author, or Ashley Black, or anybody else, is once you feel that you've gotten a treatment result from your Fasciablaster, don't do anything for 3 or 4 or 6 weeks and re-photograph your legs, and let's see if there's really a difference. So that's the first question I have for him. Excuse me. The second question I have is, I think they had, when I looked on her website, there were about 20 or 25 pictures that looked quite good. I know there's thousands and thousands and thousands of people that have tried it, because it's obviously a much less expensive alternative. So the other question is, it'd be nice to see a study where they've done 25 or 50 or 100 random women and followed them and seen their progression. And again, as far as I know, that's never been done. So am I positive it doesn't work? Absolutely not. I don't know for sure, but I have a healthy bit of skepticism, and I'll be interested to see if in 5 years' time people are still using this device.